My name is Dr. Damon Adamany. I'm an orthopedic hand surgeon with the Core Institute. I did my fellowship training in Albuquerque at the University of New Mexico, and that was in hand surgery. I did my residency in Ohio at Mount Carmel, and then my undergraduate training and medical school training were both done at University of Arizona here in Tucson. I decided to practice medicine early on in my life. I was 4 or 5 years old, and I don't have a good answer as to why I started thinking about medicine that early, other than I thought that it was a field that certainly made an impact in many people's lives. It was universally needed, and I felt like it was a calling for me. So I decided to specialize in the field of hand surgery because it is a unique field in that it is very focused, it's very meticulous, but it also is very broad. So on a certain day I might be working with somebody who might need a nerve repaired under a microscope, and then the very next surgery might require a large forearm bone that needs to be repaired and with plates and screws. We also do things such as arthroscopy, which is where we put a small camera in somebody's wrist to help with their ligaments, and so it's very diversified, but it is a very narrow area where I felt like I could specialize and become proficient at it. So my care philosophy is essentially I treat the patients as if they were my own family members. So oftentimes I'll get asked, what should I do in this situation? And my response will be, well, if you were my father or if you were my mother, I would do X, Y, or Z. And I feel like that's what patients are really looking for when they're trying to make significant decisions such as their health care. So I see all patients of any kind, so anywhere from age 2 to 102. I've operated on patients as young as that and as old as that. I generally see upper extremity patients, so I subspecialize in surgery of the upper extremity, generally from the elbow down, but I also do orthopedic trauma as well and take care of a lot of our older patients who may happen to have had a hip fracture. So the conditions I see in my clinic most commonly include carpal tunnel syndrome. We get things like carpal tunnel and trigger finger as well. We oftentimes will see patients who have thumb arthritis or arthritis of their other small joints in their hand. We obviously also see quite a bit of trauma as the hands are most often injured with traumatic events. I hope when patients walk away from my office they feel like they've had their questions answered, that I've taken the time to focus in on them as well as their condition, that I've listened carefully, and that I've addressed all their concerns. I sometimes won't have a solution for their problem because there may not be a solution, but I hope that they walk away feeling like they've had all their questions answered and that they feel good about the visit, that I've addressed any issues that they might have. Well, certainly one of the most rewarding things about being an orthopedic surgeon is that you get tangible results. So I, for instance, may fix somebody's bone and the next day they may be walking on it or maybe using their arm again, and you can see that tangible result from one day to the next. I don't have to wait 6 months to a year to see that my results or that my work and my help has paid off. So that is very rewarding.